Kidney today. What? Susan, we talked about this on the phone 4 days ago. You agreed to do the procedure today. Your sister's already...
My sister?
You're not allowed out of post-op yet.
Post-op? Yeah, turns out I was a perfect match. My kidney's in a cooler down the hall. You can either accept it or throw it in the trash.
Oh, boy. This is not going to look good in front of the board.
Are you insane? You had your kidney taken out after I told you no.
Susan, hi. Look, I know you don't care what I think, but I have to let you know that I am so happy that you agreed to do this.
Oh, I didn't agree to anything. My treacherous sister has concocted a gigantic tissue of lies to trap me, but it's not gonna work.
What? Well, she didn't... Okay, for future reference, this is the crazy thing I was talking about.
I cannot believe you would be so spiteful as to let yourself die after what I have done for you.
What you have done for me? I am so sick of this. You know, you actually have me looking forward to the afterlife.
Good luck. Dad's there. Susan, please, just take the kidney. I don't want to lose you.
Okay, you know what? Can you do me a big favor and just stop pretending like you care about me?
What? Susan, I love you.
Oh, please, you never loved me.
Did you see the scar? When I was 6 and you were 4.
Okay, y'all. This is so interesting. Okay? Remember I told you I was going to speak to you about kidney failure? Well, the words, you know, the knowledge, the education is definitely going to come out. That was just a notation of Malcolm in the Middle, where Lois's sister actually needed an organ transplant, a kidney transplant, and they never spoke. Her sister never told her about, you know, told her about her to the doctor. And Lois, out of kindness of her heart, because she knew that her relative and her blood needed a kidney, she wanted her to live, and she knew that it was the right thing to do. But excuse me, as we watch the show, it is more into it. But let me tell y'all something. Even on The Sims 3, whoever's a fan of The Sims 3 game, they even have jobs where you're actually a donor, an organ donor. And let me tell you something. I was playing one day, and I clicked the job for the medical career for the organ donor, and they called, like, you know, if you understand The Sims, it's like an animated, stimulated game. It's almost like human-like. And let me tell y'all something. They called, like, in the middle of the night saying, oh, because I was a staff at the hospital, asking me would I be able to give a kidney to a patient. And you know, because it results, like, in my life, it actually reflects on my life. I said, heck yeah. And, you know, in the game, I rushed to the hospital and gave that patient a kidney. But I wanted to explain to you, this paper is actually from the health fee I did 2 years ago. And it's about kidney failure, and it just gives you a definition of what kidney failure is. I'm going to let you know later on what my views are about it and what I thought it was about. Okay? Kidney failure occurs when one or both kidneys are not able to perform their usual functions. The kidneys are two bean-shaped organs in the lower back. So they're basically right here. They're right here in your back. You have two, like, right here. So that's where your kidneys are, and everybody is supposed to have two. In the lower back, their main function is to remove waste from the body and to balance the water and electrolyte content of the blood by filtering the salt and water in the blood. The waste and water excreted by the kidneys combine to form urine. And a lot of kidney failure patients actually do not use the bathroom. Can you imagine? You lost that function. You can go to the bathroom. You can do this. You can do that. And then all of a sudden, you can't go to the bathroom. It's like, it's heartbreaking. It is very heartbreaking. Acute kidney failure means sudden loss of kidney function. Chronic kidney failure, slow, gradual loss of kidney function. If kidney function is reduced to 20% of normal function, serious health problems develop. When kidney function decreases to 10% to 15% of normal, dialysis or transplant is needed to maintain life. Okay? That is just a rundown of what kidney failure is, like the definition of what it does and what it is. There's a lot more to it. The two most common causes of kidney failure are diabetes. Remember I spoke to you all about diabetes? Those diabetics, eat right, get yourself together, get it together. Long-standing high blood sugar that results from diabetes damages the nephrons. High blood pressure, okay, long-standing high blood pressure damages the capillaries in the kidneys. The capillaries. Well, we're going to do a breakdown later of what all of this stuff means, the nephrons and the capillaries. Other causes of kidney failure may include, wow, these words are hard. Polycystic kidney disease, birth defects, poisoning, severe trauma, pyelonephritis, and glomerulonephritis. Okay, long-term use of medicines that contain aspirin. Those who rely on aspirin because you're not feeling well or, you know, you get headaches, you better watch it. They can hurt your liver and your kidneys. Acetaminophen, ibuprofen, okay? Oh, these are stuff that are in your, like, Robitussin, oh, wow. Blockage of the urinary tract due to bladder or colon tumor, large kidney stones, and large prostate. Men, take care of your prostate. It's very, very serious. Take care of your prostate. Blood buildup of abnormal substances within the kidneys, such as protein buildup. Whoa. And amyloidosis. If you're a nurse or doctor watching this, please correct me on my pronunciation. They're really long and hard. Topic reaction to drugs of X-ray dyes. Systematic diseases include a systematic lupus. Alright? And polyarteritis, and Wagoner's, and good pastures granulomatosis. Conditions that severely decrease circulation fluid blood volume, such as severe blood loss, burns, pancreatitis, peritonitis, sepsis, heart failure, liver disease, shock due to any of the above conditions of a sudden and severe drop in blood pressure. Okay? And these are the risk factors. A risk factor is something that increases your chance of getting a disease or condition. Risk factors for kidney failure include diabetes, high blood pressure, lupus, long-term use of painkillers containing aspirin or NSAIDs in high doses, liver failure, HIV, cancer, recent open heart surgery, recent surgery on an abdominal aortic aneurysm. Oh, wow, y'all. This is a lot. This is a lot. This is definitely going to have to be a part 2 because can y'all handle this? Can y'all really, really handle this? I don't even know if I should do it anymore. It's a lot, y'all. It's a lot. You know, sometimes if you're walking down the street, you get a headache or you don't even know what's wrong with you. Well, I'm going to do a part 2 because my time is almost up. All right? I'll see you in part 2. All right? Part 2. I'll see you later.